So statements like this one, any fool can cut off an arm or a leg, but it takes a surgeon to save one, reflects the disdain our speciality carries with us for the performance of an optimization, of an amputation. And I just want to echo what the previous speakers have said, that, limb optimization is really where we want to focus. We know this isn't true. A well-executed amputation is a reconstructive procedure rather than a surgical failure. And if we can achieve the goals of a pain-free stump, which functions optimally with acceptable cosmesis, we can really make a vast improvement to an amputee's life. People like Pride Mafira and Bethany Hamilton show us that we're capable of much more than we think, and often large limitations to our potentials are actually self-imposed. So what are the principles? We want to preserve length at all costs, even if that means needing to do advanced soft tissue reconstruction and able to maintain functional length of a stump. We want to preserve growth plates, and we want to disarticulate rather than performing transosseous amputations. Always try to preserve the knee joint and then extensor mechanism if possible, and we may need to stabilize or normalize the proximal segment like with superhip procedures. And we want to pay appropriate general attention to the child and his social circumstances, his family, financial constraints, all of those things when we plan this sort of reconstructive operation. So what are the indications? Congenital conditions, certainly. Trauma, specifically in low and middle income countries, we really have a major problem with road traffic accidents, frequently patients presenting to us with mangled extremities, vascular injuries, and compartment syndromes.